Welcome to the Deep Dive. Today we're looking at a health issue that might be closer to home than you think, especially if you share your life with maybe a smaller, older dog.
Hmm.
We're diving into atrioventricular valve disease, sometimes called myxomatous valve disease.
Right.
Sounds technical, I know, but it's surprisingly common, and, well, understanding the basics can really make a difference.
Absolutely. And our goal today, is to really get to the heart of this condition, pun intended.
Yeah, good one.
We got a detailed medical overview as our source. We're going to pull out the key bits, try to cut through some of that uh, complex jargon, maybe,
Yeah, definitely.
and just highlight what's most important and honestly quite interesting for you to know. Think of it like your shortcut to feeling well-informed.
Exactly. We want to unpack what this disease actually is, how it tends to develop, over time,
Yeah.
which dogs are most prone, what the early clues might be, and crucially, what can actually be done about it. So let's start right at the beginning. What is actually happening inside the heart with these valves?
Okay. So at its core, this disease involves a gradual weakening, a
Mm.
sort of disorganization of the connective tissue, specifically in the heart's atrioventricular valves.
And those are the mitral and tricuspid valves.
That's right. The mitral between the left atrium and ventricle and the tricuspid on the right side. The term myxomatous just describes the specific kind of degeneration happening at a microscopic level.
So it's more than just the valves getting a bit old and stiff.
Oh, much more. Our source details that a specific layer inside the valve called the spongiosa, it gets much thicker, more prominent.
Okay.
And within that layer, there's a buildup of these substances. Think of them like sticky, disorganized goo almost. Mucopolysaccharides and glycosaminoglycans.
Right.
And they contribute to the thickening and ultimately the weakening of the valve leaflets themselves as the disease gets worse.
And that thickening must affect how the heart functions, right?
Absolutely. And it's not just the leaflets. The chordae tendini, those little stringy bits that hold the leaflets in place,
Yeah.
they also degenerate. They can get thicker and longer. And that can lead to valve prolapse.
Prolapse.
Yeah, imagine the valve leaflets kind of bulging backward
Hmm.
into the atrium when the heart squeezes. That's basically what happens during systole.
Ouch. That sounds
Right.
like it would cause problems. So what's the immediate effect of these thickened, bulging valves?
Well, the main problem is the leaflets just don't close tightly anymore. They don't meet properly when the ventricle contracts.
Okay.
This incomplete closure, insufficient coaptation is the term, lets blood leak backward from the ventricle back into the atrium. That's regurgitation.
And the worse the valve damage, the more leak.
Exactly. The severity of that backward flow, the regurgitation, directly depends on how badly damaged the leaflets and those chordae are.
Okay, so the heart's having to pump harder because some blood's going the wrong way. How does the body try to cope with this initially?
The body's actually pretty amazing at trying to compensate at first. Right. The heart chambers involved, especially the affected ventricle and atrium,
Mm-hmm.
they'll start to stretch or dilate. And they undergo something called eccentric hypertrophy.
Eccentric hypertrophy.
Yeah, think of it like the heart muscle fibers getting longer rather than thicker. The chambers get bigger to hold the extra blood volume.
Okay.
The heart also tries to beat harder and faster to keep enough blood moving forward. And if it's the left side affected, the lungs drainage system goes into overdrive trying to clear potential fluid.
Wow.
Plus, the body tries to hang on to more fluid overall and activates certain hormones to kind of boost the whole cardiovascular system.
It sounds like the body really throws everything at it, but I guess eventually those efforts aren't enough.
Sadly, yes.
Yeah.
As that valve leakage gets worse and worse, these compensatory tricks just can't keep up.
Mm-hmm.
Eventually, you get a drop in cardiac output. The heart just can't pump enough blood forward effectively. And pressure builds up in the veins behind the failing side.
So that leads to...
Well, if it's the left side struggling, that increased pressure backs up into the lungs, causing fluid to leak into the air spaces. That's pulmonary edema. That's left-sided congestive heart failure, or CHF.
Okay.
If it's the right side failing, the pressure backs up into the body's circulation, and you can get fluid building up in the abdomen. That's called ascites, right-sided CHF.
That sounds really serious. The source also mentioned a really acute risk, though maybe rare.
Yes, it's uncommon, thankfully.
Yeah.
But in some severe cases, the high pressure inside the atrium can actually cause a tear in its wall,
Oh, wow.
which can lead to something called cardiac tamponade.
Yeah.
That's where blood leaks into the sac around the heart, squeezing it and stopping it from beating properly. It's a major emergency.
Goodness. So, switching gears a bit, who actually gets this? Is it certain dogs? You mentioned older, smaller dogs earlier.
Yeah, that's the main demographic. It is by far the most common heart condition we see in dogs, period.
Really?
All
Most
right.
common.
Yep. And its likelihood is really strongly tied to age. You almost never see it in young pups.
Hmm.
But it gets incredibly common as dogs get older.
How common?
Well, in some breeds that are really predisposed, the numbers are staggering. Like over 90% of dogs over 10 years old can have it.
90%.
I
Yeah.
know, it's huge.
Like that.
And really quite worrying if you own one of those breeds. In terms of species, it's overwhelmingly a dog problem. Extremely rare in cats.
Okay, over 90%. Which breeds are we talking about here? The ones most at risk.
Definitely. While, it can happen in larger dogs, it's much, much more common in smaller breeds. Generally dogs under, say, 20 kilos or about 44 pounds.
And the specific breeds.
The classic one is the Cavalier King Charles Spaniel. They're kind of the poster child for this,
My
unfortunately.
favorite that.
But also Chihuahuas, miniature Schnauzers, Maltese, Pomeranians, Cocker Spaniels, Pekingese, Poodles, both miniature and toy. It's quite a list.
So lots of popular small breeds.
Exactly. If you have one of these little guys, this is definitely something to keep in mind as they get into their senior years.
Okay, so those are the breeds. When does it typically show up in their lives?
Well, a vet might detect a heart murmur, which is often the first clue, maybe as early as 2 years old in some of those really susceptible breeds.
2 years. That's young.
It is, but that's just the murmur. The peak age for actually diagnosing the valve disease, especially in breeds like Cavaliers, tends to be more around 6 to 8 years old.
Okay.
And if it progresses to the point of causing congestive heart failure, that typically happens later still, usually between 8 and 12 years old.
And is there any difference between male and female dogs?
There is, actually. The source indicates that male dogs tend to develop the disease, or at least show signs of it, at a younger age than females.
Interesting.
So what that means is, if you look at dogs of a specific age, you're likely to find a higher percentage of males affected compared to females.
Huh. Good to know. Okay, let's talk about what owners might actually see or notice. What are the signs that could point towards this developing?
Right. The signs really depend on how far along the disease is, and vets often use a staging system to help categorize this. It's from the American College of Veterinary Internal Medicine, the ACVM, helps track progression.
Okay, a staging system. Let's break that down.
Yeah.
What does each stage look like?
Sure. So stage A isn't really a stage of disease yet. It's just dogs that are considered at risk because they belong to one of those high-risk breeds we just talked about.
Okay, no signs yet, just the breed risk.
Exactly. Then you have stage B. This is where there's evidence of the heart disease,
Right.
the valve problem, but the dog isn't showing any obvious outward clinical signs yet. No symptoms the owner would necessarily notice.
So what might a vet pick up in a stage B dog then, maybe during a checkup?
Well, sometimes an early finding can be something called a systolic click, just a little extra sound the vet might hear with a stethoscope. But the key finding in stage B is usually a systolic murmur. That's that whooshing sound caused by the leaky valve when the heart contracts.
Right.
It's typically loudest over the mitral area on the left side, or sometimes the tricuspid area on the right. The loudest can vary, and as the valve damage gets worse, the murmur usually gets louder, and you can hear it over a wider part of the chest.
And you mentioned stage B has subdivisions.
Yes, and this is a really important distinction, B1 versus B2.
Okay.
In B1, the dog has the murmur, but X-rays, or an echocardiogram that's an ultrasound of the heart, don't show any obvious changes in heart size. The heart looks structurally normal, basically.
Right.
But in stage B2, the dog still doesn't have outward symptoms. But those imaging tests do show evidence of heart enlargement, or cardiomegaly. The heart chambers are starting to stretch.
And why is that distinction so important?
It's crucial because it affects management decisions.
Yeah.
And interestingly, our source points out that even now, the best way to manage stage B2, that stage with enlargement but no symptoms, is still debated and researched.
Ah, okay, so treatment isn't always clear-cut at that point.
Exactly. Whether starting certain medications at that B2 stage actually slows things down is, well, it's still an active area of study,
Yeah.
which is important for owners to understand.
Got it. So what happens when things progress further into stages C and D? That's when the clinical signs become obvious, right?
That's right. Stage C is when a dog develops clinical signs of congestive heart failure due to the valve disease, and stage D is basically refractory or end-stage heart failure that's harder to control with standard therapy.
So what signs are we talking about here?
Well, the heart murmur is usually quite loud by this point.
Yeah.
You might also hear or feel changes in the heart rhythm, like tachycardia, a heart rate that's too fast.
Okay.
Or they might lose that normal, subtle speeding up and slowing down of the heart rate with breathing that's called respiratory sinus arrhythmia. And actual irregular heartbeats, arrhythmias can definitely develop. Sometimes you might feel a pulse in the leg that seems weaker, or like it skips beats. That's a pulse deficit.
What about things an owner might notice just watching their dog at home?
Yeah, you might see signs that the circulation isn't as good, like the pulse in the back leg, the femoral pulse might feel weaker.
Mm.
Or if you press on the gums, the pink color might take longer to return. That's prolonged capillary refill time.
Mm-hmm.
The gums might look paler than usual too, but the big things, especially with left-sided failure, are related to breathing.
Like difficulty breathing.
Exactly. Increased breathing rate or effort to chypnea or dyspnea. Sometimes they adopt a specific posture to help them breathe, standing or sitting with elbows out, neck extended. That's orthopnea.
Okay.
And if a vet listens to the lungs, they might hear crackling or rattling sounds, rales due to the fluid. So yeah, if your older dog seems to be tiring more easily, coughing, or having any trouble catching their breath, this leaky valve is definitely a suspect.
Those all sound pretty worrying. Are there any like really severe get to the vet now signs?
Yes, absolutely. A really alarming sign indicating severe pulmonary edema is if you see pink, frothy fluid coming from the dog's nose or mouth. That's an emergency.
Wow. Okay.
And if it's predominantly right-sided heart failure causing the problems, you might see that abdominal swelling we mentioned earlier, ascites, a noticeably bloated belly.
So it starts with the valves, but it can really impact the whole body. We've talked about what it is, who gets it. Let's dig a bit deeper into the why. What actually causes this valve degeneration?
You know, that's the million-dollar question, really. The primary cause is still officially unknown.
Still, even though it's so common.
Still. But given those incredibly strong breed links we discussed, there's a huge suspicion, almost a certainty, that genetics are heavily involved.
Makes sense.
The leading idea is that it's some kind of genetically programmed problem with how the valve tissue develops or maintains itself over time, a dystrophic process. And the age it pops up seems to be inherited in a complex way.
How so?
It's thought to be what's called a polygenetic threshold trait.
Polygenetic threshold trait. Okay, can you simplify that a bit?
Sure. Think of it like needing several different risk genes adding up together.
Right.
It's not just one bad gene. You need a certain combination or a certain dose of these genetic factors to push the dog over a threshold where the disease actually starts to develop.
So multiple genes contributing.
Exactly, which explains why it's so common in certain breeds, but not strictly Mendelian, like a simple dominant or recessive trait.
Yeah.
And it also influences when it develops more risk genes, might mean earlier onset.
That makes sense. And it really highlights why responsible breeding is so important for those predisposed breeds.
Absolutely. And it also, points towards the future hope for maybe genetic testing down the line to identify at-risk dogs even earlier.
So it's primarily this complex genetic predisposition. Are there any other major risk factors identified in the source besides the breed?
The main other one mentioned is sex, which we touched on. That tendency for male dogs to develop the disease earlier than females.
Okay. So breed and sex are the big ones. Now, let's say a vet suspects this might be going on. How do they confirm it? What's the diagnostic process like?
Well, first they have to consider other possibilities, because several things can cause similar signs.
Like what?
The source lists things like dilated cardiomyopathy, that's a different heart muscle disease, congenital heart defects the dog was born with, even infections on the heart valves called bacterial endocarditis,
Okay.
and non-heart stuff too, like chronic bronchitis, pneumonia, or even heartworm disease, depending on the region. So, ruling things out is part of it.
Right, the differential diagnoses. What about standard lab tests? Blood work, urine tests, do they help?
Often the routine stuff, CBC, biochemistry, urinalysis, is surprisingly normal, especially in the early stages.
Really?
Yeah, unless the disease is quite severe or the dog's already on medications like diuretics, which can affect kidney values or electrolytes.
So what might they see in more advanced cases?
You might see what's called prerenal azotemia. That's elevated kidney numbers because the heart isn't pumping blood to the kidneys effectively. Usually the urine is concentrated in those cases unless there's underlying kidney disease too. And with right-sided heart failure, because blood backs up into the liver, you might see elevated liver enzymes.
Are there any more specific blood tests for the heart itself?
There are tests like natriuretic peptides, hormones, where the heart releases when it's stretched or stressed.
Yeah.
They tend to be elevated in moderate to severe disease, but might be normal early on. Same with troponin I, which measures heart muscle damage, usually only up in very advanced cases.
So it sounds like blood tests give some clues, but aren't the main diagnostic tool here?
Not for the primary diagnosis, no. Imaging is really where it's at for confirming this condition.
Imaging, so X-rays and ultrasound.
Exactly. Chest radiographs, X-rays are super helpful. They show the overall size and shape of the heart.
What do they look for?
In early stages, the heart might look normal size. But as it progresses, you'll typically see enlargement, especially the left atrium and left ventricle. Left atrial enlargement is often one of the earliest signs you can see on an X-ray.
Okay.
And, crucially, if the dog is in left-sided congestive heart failure, the X-rays will usually show signs of that fluid buildup in the lungs, pulmonary congestion, or edema.
And the ultrasound, echocardiography.
The echo. That's really the gold standard. It lets us see the heart beating in real time. It's amazing.
What can you see on an echo with this disease?
You can directly see the thickened, distorted valve leaflets. You can see those chordae tendineae. Are they stretched? Are they ruptured? You can actually see mitral valve prolapse happening.
Wow.
You can measure the size of the heart chambers, see that atrial and ventricular enlargement. You can assess how well the heart muscle is contracting. Sometimes it's hyperdynamic, working extra hard early on, then it might weaken later.
And the leakage itself?
Yes. Using Doppler, which shows blood flow and color, you can literally see the jet of blood leaking backward into the atrium. You can even estimate how severe the leak is.
That sounds definitive.
It's incredibly informative. Echo also lets us check for complications, like pulmonary hypertension, high blood pressure in the lungs, which can happen secondary to the valve disease.
So X-rays give the big picture, echo gives the fine details. Are there any other procedures sometimes needed?
Well, checking blood pressure is important, especially if the dog has severe disease or is on diuretics or other meds that affect pressure. Blood gas analysis can tell us about oxygen levels, especially if they're having trouble breathing, and help monitor response to oxygen therapy. If there's fluid in the belly or chest, draining some off abdominocentesis or letter and analyzing it can help confirm it's due to heart failure.
Okay.
And an ECG, electrocardiogram, can be useful too. It might show that fast heart rate, signs suggestive of chamber enlargement, or detect any arrhythmias that are present.
That gives a really clear picture of the diagnostic toolkit. Now, if we were to look at the valves themselves, say pathologically after a dog has passed, what do they actually look like?
Right. Grossly, meaning what you see with the naked eye, the changes can vary. It might be just small, firm, bead-like nodules along the edges where the leaflets meet.
Okay.
Or, in more severe cases, the whole valve can be really distorted by these larger, grayish-white, thickened nodules or plaques. The leaflets can become kind of stiff, contracted with rolled edges.
And the chordae?
The supporting strings, yeah. They often look irregularly thickened, maybe stretched. And you can sometimes see where they've actually ruptured or torn.
And the heart muscle itself?
Well, the overall heart size might be normal early on.
Yeah.
But in more advanced cases, you definitely see dilation, that stretching, of the left atrium and left ventricle usually. Sometimes the right side too. The left ventricle wall might thicken hypertrophy, but sometimes that's only obvious if you actually weigh the heart.
Are there other characteristic things they might see?
Yeah, sometimes you see jet lesions. These are like little roughened or opaque patches on the inner lining of the atrium, right where that jet of leaky blood hits it constantly.
Ah, from the force of the leak.
Exactly. And occasionally you might see actual tears in the atrial wall, sometimes healed, sometimes fresh, and rarely small blood clots, thrombi, can form in that enlarged left atrium.
It's really profound, the physical changes that happen. Okay, so a diagnosis is made. What can actually be done to help these dogs? What are the treatment goals and options?
The approach really hinges on the dog's state. If they're in active CHF, struggling to breathe, they probably need to be hospitalized initially. Oxygen support is key.
Right.
If they're stable, maybe just diagnosed or well-managed chronic patients, then care can usually happen at home.
What about nursing care in the hospital?
Primarily oxygen therapy if they're hypoxemic, meaning low blood oxygen. Keeping them calm and rested is important too.
And activity levels at home, does that need to change?
Oh, definitely. For dogs that have shown symptoms of heart failure, stage CD, strict exercise restriction is usually recommended. No chasing squirrels.
Okay.
Even for dogs that are stable on medication but maybe have heart enlargement, stage B2 or stable CD, avoiding really strenuous activity is wise. It's about finding that balance, maintaining good quality of life without overtaxing the heart.
Makes sense. And diet. You mentioned avoiding high sodium.
Yes, diet is actually quite crucial. The main goals are preventing weight loss and muscle wasting, that's cardiac cachexia, which can happen in advanced heart disease. So adequate calories are important.
Right.
And generally, avoiding high sodium foods or treats is recommended, as sodium can contribute to fluid retention. There are specific prescription cardiac diets available too.
Client education must be huge with this condition.
Wow.
What are the really key things owners need to grasp?
Absolutely paramount. Owners need to understand first off that this is usually progressive. It tends to get worse over time, although the speed can vary hugely. In mild cases, a dog might live for years with just a murmur and no problems. In severe cases, progression can be quicker. Owners need to know about the likely genetic link, especially if they were considering breeding that dog.
Right.
Discussing appropriate exercise, balancing quality of life,
Mm.
knowing the signs of worsening heart failure is critical, that increased breathing rate, cough, lethargy,
And medication management.
super important. How to give the pills, the importance of consistent timing, never changing diuretic doses without talking to the vet first, potential side effects to watch for.
Mm.
And a big one nowadays is teaching owners how to monitor their dog's sleeping or resting respiratory rate at home. It's a great way to track fluid status, knowing what rate is normal for their dog and when an increase means they need to call the vet.
That's really practical.
Yeah, and reinforcing the dietary recommendations too.
Are
It's
you
a lot,
saying-
but it's all part of managing it well.
What about surgery? Is repairing or replacing the valve an option?
It exists. Valve replacement or repair techniques like using sutures to tighten things up have been done. But, as the source notes, these are highly specialized, complex surgeries.
So not widely available.
Generally, no. The experience, the equipment, the cost, access is pretty limited currently.
Yeah.
It's not a routine option for most dogs with this condition.
Okay, so for the vast majority of dogs, management relies on medication.
Yes, medication is absolutely the cornerstone, and the specific drugs used really depend on the ACVME stage the dog is in.
Right. Let's go through that. What about stage B, the dog? Has the disease, maybe a murmur, but no symptoms yet.
Okay, so for stage B1, murmur present, but heart size is normal on x-ray, and echo current guidelines generally say no treatment is needed, just monitoring.
Okay.
For stage B2, that's where there is heart enlargement, but still no clinical signs. This is where it gets interesting, and a bit controversial still.
Also.
Well, our source highlights that using ACE inhibitors, which are common heart meds, in stage B2 hasn't consistently proven to slow down the progression to heart failure. The big studies haven't shown a clear benefit there.
Despite being used sometimes?
Yeah, historically they were used more often, but the evidence isn't really strong for starting them at this stage just for the enlargement. And then there's pimobendan.
The drug that helps the heart pump?
Exactly. There was a huge study, the EPIC trial, looking at pimobendan in stage B2 dogs. It did show that starting it at this stage delayed the onset of heart failure symptoms and extended lifespan compared to placebo.
Ah, so that one is recommended now for B2.
Yes, based on that evidence, starting pimobendan once a dog reaches stage B2, has the murmur plus documented heart enlargement, is now generally recommended by cardiologists to push back the start of CHF.
That's a significant development in management then.
It really is. It changed practice for stage B2.
Okay, so what about when a dog actually develops symptoms and goes into stages C or D? Let's start with acute heart failure, the emergency situation requiring hospitalization.
Right, acute CHF. The absolute #1 drug is furosemide. It's a powerful diuretic, gets rid of that excess fluid in the lungs.
How is it given?
Often as injections initially, sometimes repeated doses or even continuous infusion depending on how severe it is. The goal is to get the breathing rate and effort down. Oxygen therapy is vital too, of course, and strict rest.
Mm-hmm.
Pimobendan is also started right away, usually given orally twice a day. It helps the heart pump better and widens blood vessels, which reduces the heart's workload.
Are there other drugs used in those really critical hospitalized cases?
Yes, sometimes. If blood pressure is okay, nitroglycerin paste might be applied to the skin to help dilate veins. In very severe refractory cases, sometimes stronger intravenous vasodilators like sodium nitroprusside are used, but that requires intensive monitoring, usually in a specialist setting. Drugs like dobutamine might be given as an IV drip to give the heart muscle an extra boost if needed. And if there are significant arrhythmias, antiarrhythmic drugs would be used. Sometimes draining fluid from the chest or abdomen is necessary too.
That sounds like intensive care. Now, what about once the dog is stabilized and goes home? Or for dogs managing chronic heart failure long-term, stages C and D outpatient.
Okay, chronic management, lifelong diuretic therapy is almost always required. Furosemide is the most common one, given orally, usually twice or sometimes 3 times a day. The dose is adjusted based on keeping the breathing rate controlled.
Right. Find the lowest effective dose.
Exactly. Pimobendan is also continued lifelong, typically twice daily. It's a cornerstone.
Hmm.
Then ACE inhibitors drugs like enalapril are usually added. They help manage blood pressure and counteract some negative hormonal changes.
So, often a three-drug combo. Furosemide, pimobendan, ACE inhibitor.
That's a very common starting point for chronic CHF, yes, often called triple therapy.
Are other drugs sometimes added on top of those?
Yes, if fluid control becomes difficult with just furosemide, another type of diuretic called spironolactone might be added. It works differently and helps counteract potassium loss. Sometimes other diuretics like hydrochlorothiazide are used too.
Okay.
Digoxin is an older heart drug, sometimes used if there are specific arrhythmias like atrial fibrillation or maybe for additional heart muscle support in some cases, but it needs careful monitoring. And other antiarrhythmics if needed. Oh, and if pulmonary hypertension is diagnosed on echo, sildenafil, yes, the drug also known as Viagra might be prescribed to help lower lung pressures.
It really can become quite a cocktail of medications. Are there important precautions vets and owners need to keep in mind with these drugs?
Definitely. Using diuretics, ACE inhibitors, and digoxin needs extra caution if the dog also has underlying kidney disease. Monitoring kidney function is crucial.
Makes sense.
With nitrates like nitroglycerin, the body can get used to them, so sometimes vets schedule drug holidays if using them long-term, which is rare now. And beta blockers, which are used for some other heart issues, generally aren't helpful and can sometimes worsen things in dogs with CHF from this valve disease, so they're used very cautiously, if at all.
What about interactions between these meds?
The source mentions that furosemide's effects can be potentiated or increased by ACE inhibitors or spironolactone, so doses might need adjustment when used together. And a big one, using NSAID's common pain relievers together with furosemide and/or ACE inhibitors significantly increases the risk of kidney damage. So that combination should generally be avoided or used with extreme caution and monitoring.
Good to know. Are there alternatives if one drug isn't tolerated?
Yes, there are other diuretics besides furosemide, like torsemide, other ACE inhibitors, and other vasodilators that might be tried depending on the situation and the dog's response.
Okay, so once a dog is diagnosed and treatment starts, what does the follow-up look like? How often do they need to see the vet?
It really varies based on severity. For dogs without CHF yet, stage B, especially B2 with enlargement, regular monitoring with echocardiography is key, maybe every 6 to 12 months to watch for changes. More often if it looks moderate or severe already. Baseline chest x-rays are good too.
And for dogs who have had CHF stage CD?
After starting CHF therapy, they definitely need to recheck fairly soon, usually within 1 to 2 weeks,
Why so soon?
to check they're responding well, but also to check for dehydration, make sure their electrolytes are okay, and check kidney function, as the diuretics and ACE inhibitors can impact those, and just assess for any complications.
Okay.
After that initial period, if they're stable, rechecks might be every 3 to 6 months. But if the heart failure is more severe or difficult to control, they might need checks much more frequently.
And specific monitoring tests.
Regular blood work to check kidney values, BUN and creatinine, is standard when using diuretics and ACE inhibitors. Checking potassium levels is important too, especially with spironolactone, ACE inhibitors, or digoxin.
So it's definitely a condition requiring diligent, long-term veterinary care and monitoring. What are some of the potential bumps in the road? What complications can arise as the disease progresses?
Well, the most obvious one is an asymptomatic dog, stage B, developing actual congestive heart failure, stage C. That's the main progression we try to delay.
Right.
Once a dog has had CHF, they can have flare-ups or recurrent episodes, even on medication. Pulmonary hypertension, that high pressure in the lungs, can develop and complicate things. Sometimes heart failure becomes biventricular, affecting both sides. You can get mild fluid effusions around the lungs or heart. Arrhythmias, especially atrial fibrillation, become more likely as the atria enlarge.
Atrial fibrillation sounds serious.
It can be. It often makes heart failure harder to control. Another potential acute event is a chordae tendineae, suddenly rupturing, causing a flail leaklet, which can make the leak dramatically worse very quickly. And then those rarer things we mentioned, the atrial tear leading to tamponade or hole between the atria, and occasionally blood clots forming inside the heart, which could potentially break off.
It sounds like there's quite a range of challenges that can pop up along the way. So, what's the big picture then? The overall outlook for a dog diagnosed with this? Expected course, prognosis.
The key message from the source is that the valve lesions themselves are progressive. They don't get better. And over time, the heart muscle function itself can also start to decline, even with treatment.
So, management often needs to escalate over time.
Often, yes. Medication doses might need increasing or additional drugs added to keep symptoms controlled as things progress. The actual prognosis, how long a dog might live and what their quality of life will be, really depends heavily on how well they respond to treatment and what stage they're in when diagnosed. Early diagnosis and management generally lead to better outcomes.
This has been incredibly informative, a really thorough deep dive into, well, what sounds like a very complex condition, myxomatosis mitral valve disease. It's clearly much more than just simple wear and tear.
Absolutely. We've definitely covered a lot of ground today, from the nuts and bolts of what's happening to the valves, the strong genetic hints, to why catching those murmurs early is so vital, the power of imaging like echo, and the navigating all those treatment options, the medications, the monitoring. It's quite involved.
It really is. And hopefully this detailed exploration has given you, our listener, a much clearer, more complete picture of this very common heart issue in dogs. Hopefully you feel empowered with that knowledge now.
Yeah, definitely. And it really makes you think, doesn't it? With that strong genetic component, those breed predispositions, what might the future hold? Could we see better genetic screening? Or maybe even earlier interventions that could actually change the course of this disease for dogs down the road? It's certainly something fascinating to ponder.